Hello guys, I am Shankapriya, lecturer in SNS College of Allied Health Science. In the last section, we have started about breathing circuits, and in this section, we will be continuing with it. In the last section, we have seen about the introduction of breathing circuits and its 4 types of breathing circuits, in which we have seen clearly about open system, semi-open system, and then in semi-closed circuits we have almost seen about type A, B and C. In this session we will be continuing with type D circuit. Here is the schematic diagram of Mapleson circuit, and then we have seen about the modification of type A, which is called as lag system, and also we have seen about type B and C. So here it is type D. APL valve is brought near the back. The main circuit modified into coaxial tube, inner tube which is inspiratory limb, and the outer tube is expiratory limb. It is the most commonly used Mapleson circuit, and it is a choice for controlled ventilation. The fresh gas flow, the recommendations were the fresh gas flow can be 1.6 times of minute ventilation if the respiratory rate is 10 to 12 breaths per minute, or 70 to 100 ml per kg per minute if the respiratory rate is 16 breaths per minute. And for spontaneous breathing, fresh gas flow should be 2.5 times of minute ventilation. Here is the diagram of type D, where the fresh gas flow is brought near the patient end and the APL valve is brought near the breathing reservoir bag. So the advantages of type D is that it is a lightweight, used for head and neck surgeries, resistance is less, sterilization is easy, and the disadvantage is that the inner tube gets kinked or folded, causing obstruction. Then we have type E, which is called as Aries TPs, no APL valve and reservoir bag. It is an incomplete circuit, only for spontaneous breathing. It can be used for controlled ventilation by intermittently occluding the end of expiratory limb. Then we have type F. It is the modification of Aries TPs, Jackson and Rees circuit. It is made complete by attaching a breathing bag. It is a valveless circuit, most commonly used in pediatric cases where children less than 6 years or less than 20 kg. Spontaneous breathing, we have the fresh gas flow recommendation is about 1.6 times of minute ventilation, and for controlled ventilation the fresh gas flow should be 2.5 times of minute ventilation. So you can see in the image the fresh gas supply is brought near the patient end, and we don't have APL valve, so it is a valveless circuit, and also it is made complete by attaching a breathing bag. Next, we are going to see about the efficiencies of the semi-closed circuits. So basically we have seen about A, B, C, D, E, F circuits. So for easy clarification or clarity, we are dividing it into 3 groups. A, group 1, and B and C comes under group 2. D, E, F comes under group 3. So for spontaneous breathing, the efficiency is A is greater than DEF, which is greater than BC. And efficiency for controlled ventilation, DFE is lesser than BC, which is lesser than A. So in spontaneous breathing, A is A is the choice of spontaneous breathing circuit. And for controlled ventilation, we mostly prefer DFE. Other types of semi-closed circuits are Hafina, ABCD. Expiratory valve is replaced by the suction port, and ejecta flow meter is used in it. Then we have Humphrey system, ADE. So in Hafina system, it is commonly we have ABCD, And in Humphrey system, we have ADE. In the next class, we will be continuing with closed circuits. Thank you.